move on to our next speaker, Dr. Marci Sontag. She's the assistant professor of the Department of Epidemiology and Biostatistics and Informatics at the Colorado School of Public Health, University in Denver, Colorado. She has a doctorate of philosophy in analytical health sciences with a concentration in epidemiology. And I'm very excited about her work. She serves on several state and national committees, including the Colorado State Newborn Screening Advisory Committee, North American Cystic Fibrosis Conference Planning Committee, and Cystic Fibrosis Foundation Data Safety Monitoring Board. But today she's going to talk to us about her involvement with this project NewSTEPs, which we are very excited, and we're really glad that she's here to share the information about that.
Thank you. Can you all hear me? No. I need to go up, down. What do I need to do? Up. Okay. So thank you. So I'm going to be talking about NewSTEPs, the Newborn Screening Technical Assistance and Evaluation Program. This is a program that is funded through HRSA, similar to the NCC and the regional collaboratives. It's funded through a cooperative agreement to APHL, the Association of Public Health Laboratories. And APHL is collaborating with the Colorado School of Public Health, which is where I fit in, from the Colorado School of Public Health. And these are my great nephew's feet, and I just had to put them on there because aren't they adorable? So after Dr. Watson said earlier today that we shouldn't talk about vision statements because they're boring, I'm going to start with our vision statement because I think it helps to couch where we are. So I'll do it quickly, but our vision is that dynamic newborn screening systems have access to and utilize accurate, relevant information to achieve and maintain excellence through continuous quality improvement. So really focusing on the newborn screening system and to help newborn screening systems achieve continuous quality improvement and to improve the systems. So I was here a year ago at the very inception of NewSTEPs and the beginning of our funding, and we all had a vision for where we were going to be. And now I can tell you what have we done in the past year. So our NewSTEPs activities, and I'm going to go through each of these in a little bit more detail through my slides, but we've really focused on partnerships and outreach, talking to all of you through our activities. We've developed site visits and site visit tools. Working in collaboration with the community, we've developed quality indicators. In collaboration with HRSA, we have developed in our pilot testing case definitions for newborn screening disorders. We've developed a website and data repository for NewSTEPs. We've had some disease-specific outreach activities, and all of this is kind of under the umbrella of continuous quality improvement. How do we work to improve newborn screening systems? So first, that relationship building and partnership. You've seen this slide of the regional collaboratives, and we have gone out to each of the regional collaboratives, visit each collaborative. This is now the first collaborative that we visited for a second time. In part is to share with you what we've done, but equally important is to get that feedback from you. So we have gotten such great feedback from each of you from the regional collaboratives on how can we help support state newborn screening systems? How can we help you to achieve your goals? And getting to know everyone. So we've also gone to national meetings. We'll be presenting an abstract at the CF meetings this year. We've been to the EDDI meetings, various national meetings we've been to, and getting to know the community and identifying ways that we can help to support. And really creating a national presence, that NewSTEPs, here's what we are and here's what we're going to be doing. One of the big things we've done is program evaluation and community input. We've been asking, how can we help support you? We did a NewSTEPs data use survey, which we handed out at this meeting last year. We got great feedback on how can you use data for newborn screening. As we're building our data repository, what will be useful for you? Useful in how you enter the data, but also in how you can get data back out. And that feedback has been very important for us in building our systems. So we know what reports are useful at the state, regional, and national levels. We did a newborn screening continuous quality improvement expert survey, and we also did a Delphi process for identifying components of our evaluation tool. So what are the key components that are, when you look at a newborn screening program and say, wow, that's a great program in this area, what is that? How do you identify a good newborn screening program? So we've been getting feedback from lots of different stakeholders at many different levels for newborn screening. One of our foundation pieces is performing newborn screening system site visits. In order to do these site visits, we developed some tools, a pre-evaluation tool that has we send to the state who's requesting a site visit that they can say, hey, here's our areas of concern. Here's what we want to work on. And that can help us to form our site visit team. We perform the site visit with a site visit tool that is based on the PEAS document, based on CLSI documents, that really incorporates what has been done in the past for newborn screening and site visits. Perform that site visit, usually a 3-day site visit. Following that site visit, we give a comprehensive report on what are the strengths and weaknesses, where do we think this program can go to improve, and give some recommendations. So our first site visit was to the state of New Jersey in April. And you can see their program here, and Dr. Scott Schoen down in the bottom, and Jalili Ojudu, who I think is correct. I think most of us know Jalili. So went to New Jersey and got a lot of good feedback from them on how to improve our process, as well as providing good feedback to them on what they can do in their state to improve the newborn screening systems. We have an interactive website. This is at www.newsteps.org. Right now we have the kind of foundation of our website. There's a lot of information there, but we have a work group that is very carefully looking at all of the ways we can grow this website and really have it be the comprehensive resource for newborn screening systems. Along with that website is our voluntary data repository. The data repository is open and live now for basic information about the state profile. So we've identified one person from each state that has the access to go in and edit that. I encourage you to go and look at your state and see what information is up there. We have information on the disorders that are screened, contact information for each state, et cetera, some of the basic information from the state. In September, we will be debuting the more comprehensive data repository. We'll be collecting information on quality indicators and on the incidence of the disorders identified in your state, et cetera. I haven't mentioned this yet, we are working in partnership with 5AM Solutions. They are the contractor who is doing the data repository and website for us. They may sound familiar to you as they are the group that is supporting NBS TRN and their website and the virtual repository of dried blood spots. So it's working very well for us because there's a lot of things they already know about newborn screening and the newborn screening system. So this is very light, it didn't copy well, but this is what a piece of our website looks like with the interactive maps. You can click on a state, and I clicked on North Carolina since that's where we are. When you click on North Carolina, it will pop up with all of that information that I just mentioned. So again, I encourage you to go and look at that. Also within our data repository, you can get access to the quality indicators and the case definitions. So speaking of quality indicators, this has been a 2-year project to develop a list of quality indicators for state newborn screening programs. They're listed here for you to briefly look through them, but I really would encourage you to go to our website and look at them. We've also sent them out for public comment. So they have gone through 3 different iterations of community input. So this is not a NewSTEPs program, a NewSTEPs quality indicators. These quality indicators were developed by the newborn screening community. 3 different committees have looked at these and have given us feedback. We've gone through the definitions, so now they're out there for public comment. And we would love to have your edits and comments on these to say, hey, this is great, but you need to tweak this definition just a little bit. So within these quality indicators, we'll be creating reports at the state level. So the state can see, hey, here's how I compare to the rest of the country, how I compare to those outcomes from the rest of the country. We'll also be giving them to the regional collaboratives to say, here's what the states in your region look like. However, at no point will your state be identified to the other states. There will be a bar or a outcome for your state that will be displayed, but it will be anonymous. You will know which state is yours, but no one else will know who you are until you say, hey, that's me, and I really would like to improve this area, but all the rest of that will be anonymous. So a draft of those quality indicator reports is also available on within our repository. So I encourage you to look at that and see, please give us feedback on, this looks great, but I'd love to see this tweaked a little bit, or any feedback you have. We've also been doing some disease-specific outreach. The big thing is CCHD, as you heard from Dr. Kemper and Dr. Bikini talking about CCHD being approved in the past couple of years. We are providing that technical assistance for states who are implementing CCHD. We have monthly technical assistance TA calls, and then we're also working with other groups to identify resources for CCHD and providing those resources to states. we've had some discussions with the Cystic Fibrosis Foundation about how we can connect our NewSTEPs data repository and newborn screening outcomes to their longitudinal CF Foundation registry. So those are conversations that are just kind of in the early stages, but this is where we're heading, and we'd also like to, are also having discussions with NBS TRN on how can we connect with their long-term registry as well. So NewSTEP staff, as I'm finishing up here, this is our NewSTEP staff. Our director is Jalili Ojudu at APHL, and we have a fantastic staff both at the Colorado School of Public Health and at APHL that really support NewSTEP's activities. So we will be, you might see any one of us at any of these meetings, and please feel free to reach out to us and contact us. We might be reaching out to you to have you help us with one of our work groups. So in summary, NewSTEPs is partnering with newborn screening programs to provide technical assistance and resources, collate and summarize data in aggregate form, and develop opportunities for quality improvement at the local, regional, and national levels. Here's just another slide. And before I finish, since I think I have about 2 minutes and 10 seconds left, I just wanted to say this, a draft slide that we're still working on, and there's some graphic editors who are going to help us make this look prettier, but just to give you an idea of how we all fit in together, that this is a community, and NewSTEPs is really geared at newborn screening programs in the newborn screening system. So from the time the baby is newborn screened until they get into long-term care. That's really our goal, is to help support state newborn screening programs in that area. But you can see that Baby's First Test, another HRSA-funded program through Genetic Alliance, they really are focusing on the education of parents, caregivers, and primary care providers as it relates to newborn screening. And NBS TRN, the NBS TRNs down here, their registry is really looking at long-term follow-up and the outcomes related to newborn screening. We also look at NCC, kind of encompassing this whole box, and I'm not sure, here's the pointer. So NCC really has influence over all of this. As the genetic regional collaboratives, we're working as the big picture for all of this. So you can see we each have kind of different target audiences that we're looking towards, but this is how we kind of all fit together, that each of these federally funded programs works together closely, and we're working with each of these partners to say, how can we share data? If we're going to approach the states and collect data from a NewSTEPs perspective, and NBS TRN needs it for some of their outcomes, we're going to share that data with them. We're also going to tell the states, here's the data that we're going to share. So it's very transparent. We're not going to be sharing data under the table, but to make it easier for the states and the federal partners as well. So I'd like to end with a thank you to the newborn screening community. NewSTEPs, there's a few of us who are funded to do this as our jobs, and we're lucky to be able to do that, but this is definitely, it takes a village. So I'd like to thank the dozens and dozens of people who have helped us so far on this project, that have served on work groups and volunteered to help us with this, because we're not in this alone, so we look forward to continuing work with you. And here's our funding acknowledgement. And then if you'd like to contact us, here's a NewSTEPs email and our NewSTEPs webpage, and also we'll encourage you to sign up for our NewSTEPs listserv, that you can do so through our webpage. Thank you very much for your attention.